I'm doing the chronic lower back pain part of this assessment. So I'm going to assume that my scene is safe and my doctor's ABCs have been cleared. This is my patient Georgia. She's 60 years old and normally suffers from chronic lower back pain and normally manages on her own with her own paracetamol, ibuprofen as required for her pain. However, today Georgia's pain is much worse. She was bending down to pick up her cat and she feels as though she may have tweaked her back. There was no blunt force or penetrating trauma involved. She is currently in a position which is most comfortable for her, and she describes her pain as being constant cramping in her lower lumbar region and has been having spasming pain over the last 4 hours. For this back pain assessment, I'm going to work my way through the musculoskeletal types of injury and then work my way through all the other body systems. So Georgia, can I just get you to wiggle forward to the seat and just turn and face me a little bit? Cool. So I'm just going to lift up your top and have a look at your back. So based on appearance, I can't see any obvious signs of bruising, swelling or deformities. I'm just going to have a feel of your back and you let me know if there's any pain, right?
Yeah.
So I'm just feeling down the centre of your spine. Do you have any pain there?
No.
Cool. I'm not feeling any deformities. It all feels normal from the thoracic spine all the way down to your coccyx. And I'm just going to feel the muscles either side of your back. Do you have any pain in there?
Oh, yeah, there.
Just there?
Yeah.
Cool. Alright, I'm just going to pop your top back down. You can sit back now and just find a position that's comfortable for you again. So based on that palpitation, it shows that Georgia has a lot of tenderness in the muscles either side of her spine on her lower back. At this point, it just appears to be more of a muscular injury. So now I'm going to start going through the other body systems. So Georgia, do you have any pain in your tummy at the moment?
No.
Do you mind if I just have a quick feel? So I can't feel any bounding masses or distension, and she's got no pain, so I'm not worried about her tummy at the moment. Do you have any pain in your chest?
No.
And can I get you to take a deep breath in for me? Do you have any pain there?
No.
Oh, and you don't feel short of breath at all?
No.
And have you been well recently?
Yeah.
No coughs or colds or flu?
No.
And have you had any fevers or shaking in the night?
No.
No. And can I get you to wiggle your toes? Perfect. And do you have any old sensation in your legs, like pins and needles, or any shooting pains down your legs?
No.
No? Cool. And does your pain, does it get worse when you lie down?
Yeah, when I lie down.
Yeah, and so it's bad when you're sleeping as well? Yeah. Alright. And have you been able to walk since you hurt your back this time?
Yeah, I walked to this chair.
Okay, but you haven't been able to move since?
No.
No. Cool. I'm just going to check the pressure in your feet. So can I get you to push down on my hand? Cool. And then pull up on my hand. Cool. And then push down and pull up. Cool. And were you incontinent this time when you hurt your back?
No.
Awesome. So now that I've gone through all the other systems, I can start formulating a treatment plan. So Georgia has no previous medical history that we're concerned about. She isn't on any regular medications other than the paracetamol and ibuprofen that she takes when required for her pain. She has no known allergies, but before giving medications I'll just double check with her. So Georgia, you don't have any allergies to any medications that you're aware of? Cool. And have you taken any of your own paracetamol and ibuprofen within the last 4 hours?
No.
And prior to this, I've determined that Georgia is not in her 3rd trimester of pregnancy. She doesn't have current paracetamol poisoning, and she is over the age of 12. So she's not contraindicated for the oral analgesia that I plan on giving her. So, Georgia, is it safe to say that you are less than 80 kilos?
Yeah.
Alright, so if you're happy, for the pain I'm going to give you paracetamol, ibuprofen and tramadol. Is that alright with you?
Yeah.
Alright, so paracetamol I'm going to give 1 gram, ibuprofen is 400 milligrams and tramadol is 50 milligrams. So prior to giving these drugs to Georgia, I'm just going to make sure I've checked them with my off-sider to make sure it's the right medication, the right dosage, and it's within its expiry date. So I'll just get you to take those with this glass of water. So these oral analgesia, they provide analgesia over a longer period of time. Should Georgia's pain get more severe and we plan on taking her anywhere or need to help her mobilise, I can consider giving methoxyflurane for her pain. Did you know with muscular pain like this that the best thing that you can do is to not stay seated for long periods of time and to just keep moving. That's so you free up your muscles and they relax, so they're not constantly contracting and spasming like they have been. So now that I've explored my treatment options, I'm going to go through the red flags associated with non-traumatic lumbar back pain to confirm my suspected diagnosis and just make sure that there aren't any red flags present. So a few of these are cleared up in my assessment, but I'll just go through them again as part of the red flags. I've got them here in my pocket CPGs. So the first one is a loss of bladder control or bowel control. So previously Georgia's told me that she had no incontinence at all. Her vital signs are all normal, so there's no abnormalities there, and her temperature is less than 38 degrees. She's had no shakes or feels like she's had any shaking from fever and no rigors. She has no pain in her thoracic spine or chest. She has no abdominal pain or tenderness. Georgia, do you have any altered sensation on the inside of your legs in your saddle area?
No.
No. She has no altered sensation and or power in both of her legs. Haven't assessed her mobility yet, but I'll do that after this. She has no signs or symptoms of a generalised illness, and she has no pain radiating down both legs. So Georgia, I'm just going to get you to see if you can mobilise quickly, if you can stand up for me, and just take a few steps. And are you okay to mobilise that way?
Yeah.
Cool, and then just take a seat back down. Georgia does have an orange flag present, which is she has worsening pain when lying down or at night when she's been sleeping. So I would recommend that you do see a GP within the next 12 hours. I don't think that at this point you need to go to hospital, but you definitely should follow up with your GP. I also have this form that I'm going to leave with you. So this is just about chronic back pain. It explains what it is, gives you some advice on managing your chronic back pain, and it also tells you when you should seek help.
My name is Georgia and I'm doing the epistax as part of this assessment. The scene is safe and Dr. ABCs have been cleared. So today we have a 21-year-old female called Zara who has called us today because she has a nosebleed. Zara usually suffers from nosebleeds, but today it just won't stop bleeding, so she's called us. I see no obvious deformity or injury to the nose, and there has been no blunt force trauma. It appears to be a mild bleed, so I'm just going to get you to pinch just above your nostrils, the fleshy part there, and I want you to compress that, and I want you to lean forward with your tissue there and just compress that for 15 minutes, and then we'll reassess and have a look and see if it's stopped bleeding. So Zara, are you usually fit and healthy?
Yeah.
And you said you had no medical history?
No.
Cool. Are you on any medications or anticoagulants?
No.
So this is important in epistaxis case, as it can become severe and could cause excessive bleeding. And do you have any allergies to any medications?
No.
Cool. And what usually causes your nosebleeds?
Usually it's just the heat, like when it's
Okay.
really hot.
And you've been well recently?
Yeah.
Cool. And you haven't had any trauma to the nose at all?
No.
Cool. And are you in any pain at all?
No.
Okay. So I've done a full set of vitals which have come back within the normal range, and it's been 15 minutes, so we've reassessed Zara's nose, and one nostril still appears to be bleeding. So I've decided that I'm going to administer intranasal adrenaline. Are you okay if we give you a squirt of adrenaline up your nostril?
Yeah.
Cool. So Zara doesn't have any allergies, and by looking at the towels, we are guessing she has lost approximately 250 mils of blood. So now I'm going to draw up 1 milligram of adrenaline with 9 ml of sodium chloride to get a solution of 1 in 10,000. And I will get my drug checked by my offsider. So I want to administer 2 ml in each nostril, so I'll use a 3 ml syringe and draw up 2 ml of the solution and label it. So I'm just going to draw up 9 ml of sodium chloride. Cool. Sharps. And I'm going to drug check my 1 ml of adrenaline with my offsider. My sharps here. Cool, and I'm going to draw up 1 mg of adrenaline. Diluted to a solution of 1 in 10,000. And from this solution I want to draw up 2 ml to make 0.2 milligrams. Cool, and now I can attach the intranasal. So Zara, because the bleeding hasn't stopped in one of your nostrils, I want to give you some intranasal adrenaline. So this part here will just sit at the bottom of your nostril, and as I administer it, it'll feel like a mist sensation up your nostril. So when I do it, can I please get you to take a big sniff in as I give it? And that'll just help it work better. So if the bleeding stops, then I'm happy to leave Zara at home today, but I'd recommend she visits her GP within the next 12 hours. But if it doesn't stop after the adrenaline, then I would want to take her through to ED. So how does that sound?
Yeah.
Okay, so I just want to get you to blow your nose as best you can, just dislodge any clots that may be in your nose.
Yeah.
Okay, so I'm just going to put them at the bottom of your nostril.
Mm-hmm.
Cool, and I just want you to take a deep, big sniff in. Cool. Alright, so now I'll just get you to do what you were doing, and so I want you to squeeze the above your nostrils and just compress that for another 15 minutes while leaning forward, and then we'll reassess again to see if you need to go to hospital. So Zara's nose has stopped bleeding after the intranasal adrenaline, so we don't need to take her to ED today. We're happy to leave you at home, but we just recommend that you go and see your GP in the next 12 hours.
Yeah.
Cool. And I also have an epistaxis sheet here, which just tells you what it is. It gives you some advice if it does start bleeding again and what to do. It also gives you information when to seek help and who to seek help from, and a health promotion strategy. Cool. And just some firm advice, just to don't pick your nose, don't blow your nose, no hot drinks or showers, as these could aggravate it.
Hi, my name is Natalia, and today I'm doing the OSCE on migraine. So today we've been dispatched to a 20-year-old female complaining of a migraine. So I've already made sure that the scene's safe, and we've done our airway breathing circulation. So I can see that my patient's airway is patent, she's breathing, and she's got a good regular radial pulse. Cool. So Georgia, can you tell me about what's happened today?
I just went for my normal morning walk, and I just got this pain in my head.
Okay. Yeah, so while we keep talking, I'm going to get my offsider to take some vitals, and they'll just be doing your blood pressure and heart rate, if that's alright.
Yeah.
Cool. So while my offsider's doing that, did you have the onset? Was it quite sudden, or has it come on over a period of time?
Yeah, it's kind of come on for a period of time.
Yep. Does anything make it better or worse?
No, not really.
Okay. And the quality, if you had to describe what it feels like?
It's just like a dull pain, but widespread through here.
Yeah. Does it radiate anywhere, like down your neck?
No.
Cool. And not into your jaw?
No.
Yeah. And if you had to rate it on a scale of 1 to 10, 10 being the worst pain you've ever felt and 1 being no pain at all, how painful?
Probably about a 6.
Okay. And does it come and go, or is it stayed throughout?
It stayed.
Yeah. So I'm also going to ask you, have you got any neck stiffness?
No.
Have you had any nausea, vomiting, or dizziness this morning?
No.
Have you had any recent trauma to your head?
No.
And with your medical history, do you take any medications?
No.
Cool. And do you have any medical history?
I have asthma.
Yeah. Good. And does your family have any history of having similar migraines or headaches or anything like that that you know of?
Not that I know of.
And the environment that you work in, has anything changed? Do you work with chemicals or any substances?
No.
And your state of health has been normal recently?
Yeah.
Yeah, no coughs or colds?
No.
So Georgia, I'm just going to run with you a couple of little tests. They might seem a bit funny, but it's just assessing to see if we can localise whether there is any lesions in the brainstem. So the first one we're going to do is olfactory. So I'll just get you to smell this for me and tell me what you can smell.
Smells like alcohol.
Yeah, perfect. Next is the optic nerve. So we're just testing visual acuity. So I'm just going to get you to read this for me.
Clinical procedures and guidelines.
Yep, that's perfect. Next we're going to do 3, 4 and 6, and that's the motor eye function. So what I'm going to do here is just get a light, move it across George's eyes and look for equal reaction to light. While I'm doing that, I'm also looking for any kind of nystagmus. So I haven't seen me in George's eyes. This is the shaking of the eyes. Cool, so I'm just going to move this across. Cool, we've got a good equal reaction there. And the same on the other side. Perfect. So next we're assessing cranial nerve 5, which is the trigeminal. This is the sensory facial nerves. So Georgia, I'm just going to get you to close your eyes if that's okay. I'm going to pop this pen on your face and just let me know when you can feel it.
Yeah. 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 Yeah.
Cool. Perfect. Next is cranial nerve number 7. This is the facial nerves. So Georgia, can you give me a big smile? And can you raise your eyebrows? Cool. So I'm seeing good symmetry there. Next is cranial nerve 8, which is the sensory ear. So I'm just going to whisper in your ear. Just tell me what you can hear.
3.
Yeah, and we'd also do the other ear as well. Next is 9, which is the sensory tongue. So can you swallow for me, Georgia? Any pain or discomfort?
No.
Cool. Number 10 is the vagus nerve. So I've been listening to George's voice and I can't hear any dysphagia. So all the muscles there are working really well. 11 is accessory. So I'm going to put my hands on your shoulders, Georgia. I'll just get you to stroke. Cool. There's no resistance there, which is really good. And lastly is 12, which is the hypoglossal. So this is just looking at the tongue to see if there's any deviation. Can you put your tongue out? Cool, so that was nice and central. So Georgia, there's a couple of other assessments that we're going to carry out. This is just to rule out that it's not meningitis or a stroke that's possibly causing the pain and discomfort today. So if I could get you to lie on the floor if that's okay. Cool, thank you. So the first one is the Koenig's. So what I'm going to do here, Georgia, is just flex your knee to 90 degrees. So if a patient feels any pain beyond this, then that is a positive Koenig sign. So have you got any pain there, Georgia?
No.
Cool, so you can pop that down. The next one is Brzezinski's. So this is when we're just going to move Georgia's neck. If she does flex at the hips and knees in pain, then that's a positive Brzezinski sign. So you'll flex your neck here, Georgia. Cool. So that's a negative sign for that one. She didn't flex or have any pain or discomfort in your knees. So you can pop back up, Georgia. I'll just get you to sit on the seat here. Thank you. So now we're just going to do a fast test. This is just to rule out it's not a stroke. So can you give me a big smile? Yeah, and poke out your tongue. Cool. I'll get you to close your eyes and just pop your hands out in front of you and then face your palms up. Cool. So I'm not seeing any weakness or drooping there. Can you hold onto my hands here? Just pull me towards you. Cool. She's got good grip strength and it's equal on both sides. Do you know where you are at the moment, Georgia?
Yeah, I'm at home.
Yep. And do you know what day of the week it is?
Tuesday.
Cool. So that's a negative fast result, which is really good. We're also just going to assess for temporal arteritis. So this usually occurs when you can feel a throbbing pain in the temporal arteries here. So I'm just going to palpate here if that's okay, Georgia. Cool. And just on both sides. So I can't feel anything. And Georgia, have you had any pain in here?
No.
Cool. So that's really good. So what we're going to do, Georgia, is just get onto this pain relief for you. Have you taken anything for the pain today?
Not today. I know one time I had Tramadol, just made it feel
It made it feel worse?
Yeah.
Okay, so what we're going to do for you today is some paracetamol and ibuprofen. Are you happy with that?
Yeah.
Cool. Have you taken those before?
Not today.
So do you have any allergies?
No.
Oh, and Georgia's not contraindicated. We know she's not in her 3rd trimester of pregnancy and she doesn't have current paracetamol poisoning. How much do you weigh, Georgia?
60 kgs.
Perfect. So she's less than 80 kgs. So we're going to give you 1 gram of paracetamol, which is 2 tablets, and 400 milligrams of ibuprofen. So I'm just going to get my offsider to drug check this. Cool. And then we're going to give that to you, Georgia, with some water. So next what we're going to do is just go through our red flags. So I have these in my pocket CPGs. This is just to rule out that there's nothing that we need to urgently transport Georgia for today. Everything else has been checking out and it just seems to be her normal migraine. Also, I've already gone through a couple of these, but I'm just going to go through them again just to make sure. So did you have any headache or neck pain following manipulation of your neck?
No.
Cool. And you don't have any neck pain or neck stiffness?
No.
Yeah. The onset of the headache, was it sudden or gradual?
Gradual.
Yeah. Georgia doesn't have a temperature. She hasn't had persistent vomiting today. Have you had any disturbances to your vision?
No.
No. And we've done the cranial nerve assessment, which rules out any focal neurological signs. She doesn't have an altered level of consciousness, and she doesn't have a history of an altered level of consciousness with onset of a headache. She doesn't have any recent trauma to the head. She's not on any anticoagulants, or she doesn't have a non-bleeding disorder. We've ruled out the potential of temporal arteritis. She doesn't have hypertension during pregnancy. She hasn't had a previous history of intracranial bleeding. Her family history, everything seems clear there, and the onset was during her walk today. So there's no red flags present. However, we do suggest that Georgia, you see your GP within the next 12 hours. What we'll do is we'll write out an information sheet. Cool, so we've fully assessed Georgia today. There's no abnormal vital signs. There's no red flags present, and she doesn't have any obvious serious illness or injury. We've seen the patient mobilised before. So what we're going to do, Georgia, is we're going to give you a PRF, and that's just a printout of what we've done today. And we're also going to give you this information sheet that we've prepared. So this just tells you what to do with your migraine. So we just want you to stay rested, keep hydrated, and continue on with your managing your pain relief with ibuprofen and paracetamol every 4 hours. We also, if anything changes, want you to call 111 immediately if anything becomes severely worse.